Hi guys, we are proceeding to page 322. Um, Still a trail guide to the body featuring the pelvis and thigh, and we are featuring the muscles adductor as a group. Please watch my other video, but this time we're gonna be presenting how to palpate, and as you can see how the therapist is having the client in a partner in a supine position, the partner in a supine position, palpating the adductors as a group. The line indicating the cross section, okay, of this one here. Okay, this is an inferior view cross section of the right thigh, grasping the highlighted adductors. Okay, so we have the partner supine with the hip slightly flexed and laterally rotate. So you can see there's a bolster there, so it's slightly flexed because we need to put them in a resting position because we don't want the muscles in a contracted or at times it could be in a spasm. By the time they get to you, they'll be in a spastic mode, right? They'll be in spasm, and we need to put them as much as possible in a very comfortable positioning. Okay, so place your hand along the middle thigh and ask your partner to adduct his hip against your resistance. So do you feel the adductors tighten? So you're going to ask your partner to alternately adduct and relax as you palpate proximally to the adductor tendons. Then move distally. So explore anterior and posterior to the edges of the adductor bellies. Okay, this is adductor as a group, and you're going to ask yourself a question. Are you on the middle side of the thigh? Explore either side of the adductors to determine if you are between the hamstring and quadriceps femoris group, and you should be on the proper landmarking. But again, guys, we need to have an additional consent for sensitive areas because this is a sensitive area. Okay, and again, informed consent on top of our informed consent, the original consent that before they got into the table. Okay, so now presenting our gracilis and adductor longus. Okay, so we have partner in supine with the hips slightly flexed and laterally rotated. So we're gonna place the flat of your hand at the middle of the medial thigh, as you can see here, as the therapist, right, is trying to locate the adductor longus and the gracilis. Okay, that's the prominent tendon of the adductors. Okay, so while your partner contracts, slide your fingers proximal to the pubic bone and locate the taut, prominent tendons of the gracilis and adductor longus extending off or near the pubic tubercle. Okay, so strum your fingertip across this tendon and follow it distally as it develops into muscle tissue. If the muscle belly slowly angles into the medial thigh, you are palpating adductor longus. If the belly is slender, my apologies. If the belly is slender and continues down the medial thigh toward the knee, you are accessing the gracilis. Okay, those are indications that you are in proper landmarking. Okay, so you're going to ask yourself these questions. The shape and the location of the sartorius. Are they similar to the shape and location of the gracilis? So distinguish between the two by simply following the muscle you are palpating proximally. So if it leads toward the ASIS, it is the sartorius. If it if toward the pubis, then the muscle is the gracilis. Okay, so we have this established. See you guys on page 323.